There are new warning signs tonight as Massachusetts tries to get control of the coronavirus. And here to explain is Dr. Shira Daron, hospital epidemiologist at Tufts Medical Center. Good to see you.
You too, Emily.
All right, let's talk about this here. The number of new cases hit a 5-month high yesterday. More than 20% of the state's cities and towns, they're now high risk for the virus. Is it possible that we've reached a peak, or do you think that there is still a ways to go here?
Well, the data suggests that right now, every infected person is on average transmitting the infection to more than one other person. So therefore, if we change nothing at all, we can expect to see the numbers continue to rise at a faster and faster rate. So the time is now to double down on those efforts to avoid situations likely to transmit the virus.
Okay, so speaking of that, everyone at the state, federal, local level are saying that household gatherings have become a major vector of coronavirus spread. So given what you've just said, do you think it's time to avoid any kind of household gathering right now, even if it's just having people over in your backyard for dinner?
Well, what people should know is that the risk of interacting with other people with whom they do not live is higher than it was over the summer. But we also have to acknowledge that the virus is going to be around for a long time. And for many people, their mental health depends on their social relationships. So we need to keep in mind, outside is safer than inside. Small gatherings are safer than larger. Farther away is better than closer together, and masks are safer than no masks.
Right, all of these things to keep in mind. Okay, I want to shift gears here for a second. We also learned that the state's wastewater plant at Deer Island, it's seeing the highest levels of virus since April. Can you tell us why this could be important?
Well, wastewater analysis tells us how much virus people are excreting into the sewage system, and those data are totally unaffected by increases and decreases in testing. So the fact that levels of virus in wastewater are the highest they've been since April tells me that we might have even more cases out there than we're seeing with the testing data. And the wastewater numbers are unfortunately consistently rising.
Wow. All right. Finally, let's talk about this new study. It says caring for COVID patients is calling unacceptable shortages of critical drugs. So hydrochloroquine is on the list. Lidocaine, acetaminophen also on that list. Have you seen any drugs in short supply? Do you think that this problem could affect medical care in Boston?
Yes. Okay. So just like testing materials, medical equipment, PPE, drugs, even the ones we commonly use for everyday medical conditions and hospitalized patients, are in short supply since the pandemic began. And all of those shortages have the potential to negatively impact the care of patients in Boston.
Well, we know that you're watching it, and thank you for giving us those hard things to look at and do when we're thinking as we move forward, balancing mental health and physical health. Really good information. Thank you so much. We appreciate your time.
Thank you.